For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.
Welcome to Telehealth Connection TV, a new series brought to you by Verizon for HIMSS TV covering telehealth innovations and insights. I'm Kat Jersich, Senior Editor for Healthcare IT News. On this episode, I'll be speaking with Oregon Senator Ron Wyden about his legislative push to expand access to telehealth and why safeguarding that access is so important. The future of federal regulations around telehealth has been an open question almost since the start of the pandemic, and you've repeatedly been at the forefront of pushes to expand access to virtual care. Why do you think it's so important to safeguard access to telehealth?
To put this into context, the pandemic presented many challenges, but one of the real pluses was there was a chance to marshal professionals and innovators to really step up and deal with the kind of crisis the country had never seen, a contagion unlike anyone alive can identify with. And telemedicine kind of highlights exactly what this was all about. Now, we've been working to expand telemedicine for some time. I think you all reported, for example, that when Orrin Hatch and I passed the Transformative Chronic Care Act, this is the bill to make it clear that Medicare in the future will mostly be about dealing with chronic illness, not acute care. We had a major section on telemedicine because we envisioned that here was a place to kind of put a stake in the ground and say, we're going to make sure telemedicine plays a bigger role in Medicare, particularly as it relates to acute illness. And it's clear that's going to drive this program. When I was director of the Gray Panthers, the senior citizens group, a number of years before I went into public life, when I taught gerontology, we'd ask people about Part A and Part B. Part A meant you went to the hospital, and Part B meant you went to a doctor. Well, that's really not Medicare anymore. Primarily chronic illness, and telemedicine is a key component of it. The reason I tell this story is because we made a little bit of headway with telemedicine under the chronic care bill. But when the pandemic struck and in-person visits became either impossible or an enormous lift, essentially Democrats and Republicans said, we've got to move now. There can't be any more dawdling. And the heart of what this is all about is giving patients and providers more options. We're seeing now you can scale up, that you can serve people where they live. And I, as you know, have made it clear that I envision, particularly if I have the opportunity in January of 2021, to really build on telemedicine playing a bigger role in healthcare in America, starting with the proposition that I would like to make mental health and securing mental health services a legal right in America, secured through telemedicine.
So how can more be done to safeguard access to telehealth for people who need mental and behavioral health services?
Well, I think what's important is that we kind of honeycomb through the laws and look at ways in which telemedicine can play a bigger role. I'll give you an example. At the Department of Psychiatry at the University of Oregon Health Sciences Center, they told us they were having real challenges with respect to the parity law that says mental health and physical health should be treated equally. And that what would happen is CAP might buy an insurance policy, and then you would have services contracted out to people who honored this parity requirement more in the breach than in the observance. So what I want to do is I particularly want to zero in on expanding telemedicine's role in Medicare, because we know that's the flagship health program for the federal government, the biggest program in America. And when you get it there, almost always you have an opportunity to have it replicated in the private sector.
What are some of the most important advancements that Congress can push for regarding telehealth protection, including expanding access to it in Medicare?
Well, I want to make sure that telemedicine is not reserved to just a small number of people in certain physical situations. As you know, and this was a challenge that Orrin and Hatch and I had in terms of getting the Chronic Care Act implemented. Basically, you had to live in an area far, far and away with absolutely no healthcare providers. You had to go through all kinds of rigmarole. And what I was able to do in the first of the coronavirus packages is put together a coalition so we could bring the Center for Medicare and Medicaid Services into saying, all right, we are going to finally clear out this regulatory underbrush so that in every nook and cranny of this country, there would be access to telemedicine when it was deemed by patients and their providers the best option. And as I say, given the fact that I like to think we started this in a bipartisan way, Orrin Hatch and I in the Finance Committee, I'm going to keep trying to build on it. And there won't be a program I know of in American healthcare where we aren't going to look for a role for telemedicine, because it simply is too empowering, it's too common sense, it's too cost effective to just stay tethered to these old rules and red tape, from yesteryear.
That's definitely something I've been hearing from folks who are on the forefront of these conversations, is the importance of addressing those originating site requirements. Looking toward the end of the pandemic and beyond, what are you hoping to see in the future regarding telemedicine and healthcare technology in general?
I'm very excited about healthcare technology, and I also think that it's a great opportunity for the innovators to come up with kind of new products, new services, new therapies. I mean, we know that technology, through this very difficult economic time, these companies have done very well. What we've got to do is find new ways in which they can serve more people. Certainly, if you're an engineer and if you're in marketing and the like, those have been a lot of the jobs in technology. I want to see more of those jobs focus on the kind of healthcare needs that we see in our communities across the country. And I know that when Senator Hatch and I were having hearings on the Chronic Care Act, I remember one day coming in and the room was just jammed with technology companies who were looking for healthcare services on the wrist and healthcare services that you could, in effect, get at bedside. We know that in many instances, after a patient has made one physical visit to a provider, with a little luck, you can be off to the races and have much of their care from that point on be tied to telemedicine. So those would be some of the things to look at.
Yeah, the future of remote patient monitoring technology is definitely an exciting one. Thanks so much for watching Telehealth Connection TV, brought to you by Verizon.
For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.